Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss 5 ways or 5 tricks to speed your recovery after knee replacement surgery. So number 1 is nutrition. So nutrition is often overlooked when it comes to recovery and rehab after surgery. People are going to focus a lot on icing and managing the pain, and they're going to focus a lot on the exercises and the physical therapy. But nutrition is, of course, an extremely important part of your overall health and well-being. And practicing good nutrition is going to have a lot of positive benefits for your recovery. So a couple things to keep in mind is 1, you want to make sure you're getting plenty of protein. After surgery, your muscles are atrophied, they're weak, they're not contracting as much, especially those quadricep muscles, those big muscles of your thigh that are very important for straightening your knee. We need protein and amino acids that are part of proteins to help grow and increase and strengthen the muscles after surgery. And even before surgery, taking some protein, increasing your protein intake, possibly taking a supplement can be really beneficial to speed up your recovery afterwards. You also want to look at anti-inflammatory type of foods and diets. So there's all sorts of information out there, but you want to focus on eating healthy, essentially, to keep it simple. So eating a lot of fruits and vegetables, staying away from foods that are high in sugar, foods that are highly processed, or foods that are high in saturated fats. So a lot of people might recommend such as a Mediterranean diet, high in fish that has a lot of omega fatty acids. Things like that. So overall, don't get it too complicated. Focus on healthy diet. And we all know kind of what is a healthy diet. Lots of fruits, lots of vegetables, getting adequate protein from lean proteins without a lot of fat. So fish, chicken, things like that. You can also, of course, a lot of nuts and seeds can be really beneficial. But trying to eat foods that are anti-inflammatory, are going to not increase the inflammation that's already going on as a normal healing process. So protein and anti-inflammatory diet. The second tip or trick is focus on multimodal pain management. And what I mean by this is after surgery, you're going to get prescribed pain medicine, most likely, or a combination of pain medicine with Tylenol, some sort of acetaminophen-based medicine, and possibly also an anti-inflammatory such as ibuprofen. And those are important aspects and important parts of your pain management, but there's also non-pharmacological, non-medicine ways to manage your pain effectively. So this is things like icing, elevation of the knee, compression, maybe putting an ACE bandage or wearing compression garments as your surgeon might prescribe. It also means things like psychological pain management strategies, so possibly mindfulness or meditation or breathing techniques, all sorts of different things out there to help with managing the pain effectively, not just the pain medicine itself. And the more that you can effectively and positively manage your pain, you're not going to be pain-free most likely, but at least to have it at that manageable level, the more you're going to be able to tolerate your physical therapy, you're going to sleep better, you're going to feel better, and that's just going to speed up your recovery even more. So really being on top of looking at all the different modes, the different methods to manage your pain effectively. The number 3 trick is consistency. Consistency is key. A lot of people are going to go into therapy after surgery and try to get everything done and accomplish, their maximum knee range of motion and strength all within one day or a couple of treatment sessions. And that's not really how the recovery process goes. You want to focus more on consistency than rather going at a super high intensity all the time. So trying to do your exercises every day, ideally multiple times, 2 or 3 times a day, going through those range of motion exercises, going through a couple strengthening exercises, getting out and walking and doing some activities, and just staying consistent with it is going to be key. You don't have to do 100 million things every single day, but do some things each day. That consistency is going to pay off in the long run and speed up your recovery. Number 4 is track your progress and track your activity. See where you are at the beginning after surgery with a lot of pain, a lot of swelling, a lot of discomfort. You're probably not going to be able to tolerate that much. But track what you're doing. Track what you do in physical therapy, what exercises you do. If you do anything with a weight or with a band, track, how much weight it is or how much resistance you're using, or how many repetitions and how much volume you're doing. Track your activity. How much are you walking? How much are you on your feet or doing other activities? And try to slowly increase that. Our bodies need to be progressively stressed. If you think about someone who is trying to build muscle strength, the way to build muscle strength is you have to increase the stress through the body, progressively loading the body. So either increasing the weight, increasing the number of repetitions and sets or volume of the exercise. And that's the same thing for your healing and recovery with range of motion, strength, activity, tolerance. We want to progressively increase that. Now it's going to be slow and you got to play some guess and check. There might be days where you do a little too much and you have to back off, and that's okay. But we want your overall trajectory to be in a positive manner, an upward manner. So doing a little bit more, week over week, month over month. Number 5 is start to return slowly to the activities and things that you enjoy. The whole reason you get a knee replacement surgery is to return to life without pain and discomfort and being able to tolerate things and do the things you like and spend time with the people you like, doing the activities and things that you enjoy. And so the one way for motivation, one way for healing and strengthening is to slowly get back into those activities. Now that doesn't mean the day after surgery you go out and try to play 18 holes of golf if you're a golfer. It means that after a few weeks post-op, maybe you go to the golfing range and you just hit a few balls. Or maybe you do some putting on the putting green. Do things that are a little bit lower intensity, but are still part of the activities that you enjoy. If you enjoy hiking, maybe just do some walking or do a shorter distance hike or a less of an incline. If you enjoy gardening, just try, 15 minutes a day and work your way up from there. Things like that. Start at a lower level, but build up slowly. Remember, your knee is very durable. It's strong. You're going to have symptoms before you actually have any damage or injury to that knee. So you may get some flare-ups along the way where you have increased symptoms and discomfort, but know that that knee, for the vast majority of people, the integrity of the knee and the durability of the knee is going to be okay, and the reliability. So challenge yourself slowly and progressively, and you'll get back to doing those activities and those things that you enjoy and give you pleasure. Thank you very much for watching, everyone. If you found this video useful or helpful, I appreciate any likes or comments or questions below. I try to get back to everyone I see. And please be sure to subscribe and turn on the notifications if you're interested in catching all videos related to knee replacement surgery, preparation, recovery, exercises, frequently asked questions, everything else in between. Thank you very much for watching.